There we go. All right. Hi. Good afternoon, everybody. Everybody on Facebook and on soon to be on TikTok and all around the social media. We're even going to have this on LinkedIn. I'd like to introduce a couple of good new friends of mine that I met. And you guys are up in Montreal today. Is that right?
Yes.
Yeah, we're in Montreal. Katya's hometown.
That's beautiful. So that's the beauty of connectivity, right? We can do all of these incredible things now, and the world becomes even smaller. So I'm excited to introduce to you Dr. Thanos Kristallis, and he's the guy with the shorter hair and the smaller glasses, by the way. and then Dr. Katya Archabeault, and she's a maxillofacial radiologist, and they're both private practice and also work on the staff at UCSD Hospital in beautiful La Jolla. Is that right?
Yes.
Well, welcome.
Correct.
Welcome to this edition of What's Your Story? And we're going to tell the doctors a little bit about you guys, but I want to tell them about the event. So the way that we got together is we were introduced by Brian Vunovich, who's now with Dexus and part of the Invista family. And we're going to have an exciting event at a good friend of mine's restaurant. And he's a very talented guy from Sicily, believe it or not. He's making American barbecue in Oceanside, California, but he's from Vista. And he was my very first What's Your Story when I did the review on there. So I'm excited to share some good barbecue, but we're going to be meeting Wednesday, June the 14th. And you guys are all welcome. All the general dentists out there that want to learn about digital dentistry, they want to know about the surgical aspects and how that works and how we can bring all the digital elements, including the iOS cameras and the 3D printing, how we can marry all those data sets together in a nice cohesive workflow. And I'm looking at two of the specialists that have put it all together and through their own trial and error have come to to become experts in that. People look to them. So I'm excited about that event. And anyway, thank you guys for joining us. I really appreciate you making some time. And I'm excited to tell the folks a little bit about what they're going to hear. Can you guys give us an idea of, first of all, tell me how you got into speaking. How did, because you're both clinicians, but how did you get into the speaking part and get over the camera shy stuff?
You want to start, Katya?
Go ahead.
Yeah. Well, my background is prosthodontics and oral maxillofacial prosthodontics. So, once you specialize, part of it is you got to start lecturing. And lectured a lot for a lot of implant companies initially. If you look at technology, I've been practicing since 1991 in private practice. So I think everything started probably around 2000 when I first got my first trios, and I was really excited about it. Back then, the only thing we could do, Chuck, was scan, and then we just got all excited. We just started scanning every patient that came in. The technology was glitchy, the computer would freeze on us. And, like yourself, I'm a baby boomer. So when it froze, I was always, trying to figure out what's going on.
Right.
I had a technical support guy that solved it to me on speed dial. That way we were sure that he was going to, so I was calling him up and saying, oh, my computer just froze. The patient is in the chair. What do I do? And the story was always, it's your computer. The technology is good, and then I realized my laptop was updating and updating. Long story short, I was getting along with the other prosthodontists, and then we were looking at each other saying, we got all these intraoral scans. What do we do next? And there was nothing. There was no next in that workflow back then. Fast forward 20 years for now, I think I do 99% of every capturing. We're going to brag a little bit, but we got an amazing clinic as far as imaging, and of course, Katya being an oral maxillofacial radiologist and a CBCT and kind of a intraoral scanning expert. I think the imaging capacity, even the doctors, we support 29 departments at UCSD. So I would say they come over, even medical radiologists, and look at our resolution and the accuracy of the CBCT and the 3D, they call it, and they're amazed, And I'm proud to say that because suddenly 2 dentists here, we're looking good in that, hostile medical environment, so to speak, right? Because we were just the dentists. Anyways, I lectured a lot, private practice, and the beauty of trying to get out and lecture, Chuck, is because I'm a clinician, is to show your stuff. And as you go out, the journey is a learning one. So the more you lecture, the more you learn, and the more you get motivated to continue to learn, right? And that's what the whole career was about. And, you're a baby boomer, I'm a baby boomer, and then technology came in, and then we realized, oh my God, this computer and IT business is amazing, right? So we're just starting, and I'm super excited after 33 years to just keep on going, sharing the information, learning from it, making dentistry better. And at the end of the day, providing high quality care for our patients. It's all about the patients, and hopefully, we will continue to provide what they need, So that's kind of the short of it.
Yeah, that's funny. That's funny because the first scanner that I had exposure to actually was the 3M. They had to use at that time. They had to hover, and it was so awkward. And I mean, literally, the thing would time out by the time you got done scanning. It was kind of almost comical how you started out. But I remember the trios. They had those big carts. They were gigantic. You remember the big cart they had?
Absolutely.
Yeah. But they were stable, and I still see some of them out there. They still work, but the nice thing is the technology's come a long way, but the medicine and the reason you guys do what you do, those are, the patient care, right? Ultimately, it's really about taking care of patients. And can you guys kind of tell me a little bit, because we talked off camera, we talked a little bit about how basically your connection through the university led to you guys becoming a practice with the university. Katya, can you tell us about how that occurred?
Yes. If I talk a little bit about how I became to lecture that much. Well, I'm from Montreal, and I had my first scanner. We can call it a scanner in 1996 because I was the youngest Canadian at that point to get a CEREC 2. So it was like almost DOS, informatic wise. We had to put dots to find our contact point, and it was all in German. So it was quite of a journey. We did not even have customer support. There was nowhere to call back then. So, and then I always love technology. I always say that how much does it cost you not to have the technology in your office?
That's a good
Sometimes
question.
it costs way more than having it. And then I did general practice for a long time. Went back to New York, get the training in surgery for implants. So I did 2 full years in NYU, driving back and forth on the bus overnight because I had my practice there. So it was 186 trips on Greyhound. Could not do during the day because, at the airport, you lose a lot of time. So I was doing my residency from Monday to Thursday, driving overnight to the bus, working in my clinic Friday, Saturday morning, taking care of my 4 kids over the weekend, and then driving back to the bus station, taking the bus overnight to New York, getting there, first one in the clinic on the Monday morning. So I did that for 2 years, placed a lot of implants, probably over 10,000 implants. So, and then decided to, when my kids grew, we're all in boarding school, decided to apply to Maxillofacial Radiology at UCLA because it was a very, very good program. They were only taking 1 candidate. So I said, okay, my chances are pretty low. Let's go for it.
A risk taker. I like it.
So they took me. So I was like, oh my God, what am I going to do? So I kept my office for a year and a half, did the residency, 4 kids, everything, you know, it was a little too much. And I said, okay, let's stay in California, because then we had an offer at UCSD, like I was telling you, and was kind of dream practice within the hospital, having a lot of patient. Now I did my board certification also for the maxillofacial radiology. So now I'm treating maybe 98% of my patients are head and neck cancer patient. Unfortunately, I would say that I could see their cancer maybe 6-9 months before they develop symptoms, when I'm talking about head and neck cancer here, on their radiographs. So dental is not regulated as medicine. So if you break your ankle, you're going to have a medical radiologist to read your scans. But in dental, anybody can take radiographs, right? And read them. So I decided to help my colleagues, because at the end of the day, it's always for the patient. So in dentistry, it's very hard, because you have to be like a business owner, right? You have your staff, HR, you have everything, you have the insurance, you have the patient, you have to be putting so many hats on your head. And sometimes what do? You look at the radiographs, you ask your hygienist, there's anything new, you're in a rush, you know, go in and out of the operatory, look at the pan, look at 2D radiograph pretty fast, and then you miss something. So became very involved in trying to help dentists not to miss diagnosis, because there's always one diagnosis. Diagnosis come first, okay? And when I'm asked to be expert in court for cases, I always defend my colleagues. And it's never about the quality of the treatment. So dentists are good, they do good quality treatments, but sometimes they do it in the wrong patient. So let's say, for example, you're missing a benign tumor. A few months ago, got a kid, 14 years old. They sent over the CBCT for me to review, had a benign tumor in his external auditory canal. That kid would have been deaf without before having finished his Invisalign. So it was a incidental finding. Everybody was super happy. The parents were super happy. And I'm telling you, the orthodontist was very happy too, because what you want to have is a deaf kid after Invisalign. The parents won't say, oh, wow, the teeth are straight. No, they will say, wow, you missed that. How did you miss it? So I don't care how good the implant is placed, how nice the crown is done. If you miss a diagnosis, none of that will have any importance, because, and that is very important for me. So I'm always happy to share all of my knowledge to help the dentists and their staff to read the radiograph better. I'm introducing them to the wonderful world of 3D, all the DICOMs that with Dr. K. We're introducing the DICOMs fused with the STL file, and there's anything that we do. So we're a great team, because I work on the ground or in the diagnostic part, you know, doing surgery below the gum level, and he works every step above the gum. So we don't fight. I don't like anything above the gums, and he don't like anything below the gums. So
you're like the deep sea diver, and he's the guy up on the land. Yeah.
The glamorous guy. He's the one that everybody's like, wow, look at my teeth, and me, I'm the underdog.
I love it.
Hopefully the patients remember the last guy. So that's me. So I'm happy.
Yeah. Well, you know, that's an amazing, that's an amazing and really heartwarming, because you know, I think we've all, both as patients and being part of a family and stuff, we've been touched by, you know, this insidious, and I didn't even realize this, but I found out cancer is not really a disease. It's a process. Like I was really surprised to see how, you know, so many factors come into that first squamous cell and how those things happen. And we're still learning things about cancer every day. And there's treatments. We're working with a group that's doing the photobiomodulation, and it's incredible the advances that we've made and non-invasive things that we can do. So, you know, I think that's amazing. So anyway, let's get back to the event. So I'm excited for you guys to come down, and of course, the doctors that are gonna sign up and come and enjoy the evening with you. Can you tell them a little bit about just without giving away all the secret sauce and everything? Tell them a little bit about you know, let's say, for example, a lot of my general dentists, they're all in different places. Like some of them got the CT finally, right? They're placing implants. And before they were placing implants using PAs. I don't know why, but they were doing it. And so now they decided, hey, it's probably prudent if we got, but a lot of them have that and they don't know how to plan a case on the CT. They don't know much about the software, but they made the purchase. So everybody's at a different place, right? And then you add, of course, you want to add the after we create the osteotomy, get the implants placed, well, then you want to be able to do a scan. Well, how does it all work together? But can you kind of go over in the lecture what basically why should they come? Give them the why should they come?
Well, let me answer that. Like you mentioned and Katya mentioned, one thing that I think as an introduction to the participants of this course is to them to understand the big picture. You know, they always say, zoom out and look at yourself, right? Because of our specialties and our experience, and it's decades long, we can zoom out and look at the big picture. And the big picture, without giving it away before the lecture, is that today we can capture data. And when you can capture data, what do you do with that data? As we were talking, we got good software where we can interpret that. And then Katya is right. There's only one diagnosis. There's a lot of treatment plans. How do you execute? So diagnosis is something with the interpretation of the CBCT and also the STL files, you know, iOS, Chuck, they give us an enormous amount of information. And the good thing about technology is always that it's transparent. So when you just show a scan or you show the data to the patient, you know, now you're a transparent and a very good communicator, you know, with the patients, which historically was always the difficulty in our profession. You know, how do we sell a treatment plan to the patients? You know, we came up with a great, like you mentioning, a great implant case to sell. And now we're thinking, oh my God, this might cost them, you know, I'm just going to throw a number out there, $20,000 or $30,000. And that was the nerve-wracking part of dentistry, right? How do I sell them this treatment plan? Well, now it's easy because all you have to do is communicate. You know, you're just educating the patient. And I think that really builds the trust and the relationship that you have to have with a patient. And also the confidence that, you know, they see what you see, they understand it, they're excited about technology. Most of our patients are very adept to technology now, and it makes the whole process easy. Then we're going to talk about software, you know, what kind of treatment plans. If we're going to talk about implants, what kind of software do we have? How do we treatment plan that? How do we do guided versus analog, you know, and why should you do guided? How do you create the surgical guides? You know, how do you execute predictably? How do you restore predictably? So for us, and I think as an introduction to the digital world, it's more about the dentist understanding how to put all this non-integrated technologies. You know, technology was always fragmented, and we're able, because we do it, you know, on a daily basis, and we do it on very complicated and demanding patients, put all this technology together. And then depending on the workflows, you know, the smile design, or you want to do cosmetic dentistry, or you want to do full mouth reconstruction, which I am more involved in, it's a different workflow. If you want to do implants, it's a different workflow, but it doesn't really matter. It's all about understanding the big picture. So Katya's kind of the engineer, right? The designer. I'm the planner, you know, and the civil engineer. I'm not the architect. And then somebody has to construct this, which is usually me. And then what kind of lab support? And one big message that I need to tell people in advance: dentistry today cannot be done by one person. You know, I have 5 degrees and, 11 years of postgraduate studies, and I still continue to enormous experience, and I still continue to learn every day. Katya, as you can tell, you know, she's a unique person because she's a surgeon. Her father was a general surgeon, an amazing surgeon, I have to say. and I'm not biased. I've seen her in action. I'm surgically trained, and believe me, I delegated everything to Katya when I met her. She came to my office in DC and did all the surgeries because she was so fast and very efficient. So I concentrated on restoring. And if you look at from that aspect, you know, we can teach that now. We can teach the dentist to do it. So it's very important to understand that technology is all about that.
Yeah, I think that, you touched on a few things that are so important, the big picture really, because a lot of times, like you said, and Katya touched on it too, is that, as a business owner, it's hard to be in two places at one time, right? So you have to rely on your team. And in this case, that team is a number of people, and all parts have to be working in the same direction. So the general dentist now is like the quarterback, right? So there was a time that the general dentist, all they did was restore the implants. They weren't actually involved in any of the surgical aspect of it. And, you see a lot more now. I still have doctors that tell me, well, I restore implants. I said, well, how do you give a proper diagnosis and, like you said, or treatment plan? How do you do that if you don't understand the surgery? How do you know where it's going to go? How do you know, and how can you treatment plan and give a proper treatment plan if you don't understand it? You may not want to do it, and that's fine, but you should understand, how to both diagnose and treatment plan for a missing tooth if you're a general dentist. So that's great.
Chuck, absolutely right. So I think, and that's where I wanted to go, and you went with it, with the thought process. We have to create teams, and the team can be anybody. I mean, when you talk about a team, it's not only the restorative guy, the technician, and the surgeon. That was a classic pattern. Today, we're talking about companies and technology out there. We're talking about, technicians, designers, surgeons. We all have the ability, and we should start thinking like that. We have to reach out and get help and add good talent on our team. Your assistant is part of the team, right? Who's capturing the data? Who's treatment planning? And it's much easier today. Even if you don't know how to treatment plan, you can go and get a person on the team. You can come to an expert and do it. I was taking thousands of CBCTs before I met Katya. Now I know what I didn't know, right? What I was missing, so I don't even dare look at a panel and try to figure anything out. I just ask Katya, okay, what do you see that I don't see? So I added a great asset to my team. She can see because she's trained, and she can see in 3D and interpret things that I wouldn't know. And that's what it is. And I think if you look at it from this perspective, dentistry is easier today, and we can deliver accurate, precise, repeatable, predictable dentistry day in and day out, and we can grow our practice. And, we can become much more profitable. You know how hostile the environment is today, right? The overhead is going up constantly. It's difficult to make a profit in dentistry. I remember when I was practicing, I was keeping my overhead back in the 90s below, well, it was at 40%, so definitely below 50%. Now I talk to dentists, and I've met dentists that are operating in the 90 percentile. It's almost like a restaurant business, right?
Yeah.
And it's just not sustainable, Chuck. You got to become more efficient, and you're just running yourself, out of business basically, and that's frightening, from the standpoint of us.
Or the burnout. Yeah.
Yes, absolutely.
Yeah.
So there's strong arguments to be made for, for people to integrate this into the private practice and survive and thrive.
Yeah. And that's, kind of, my passion for the implants came when I became an implant representative and I got training. And before that, I was a generalist. I had helped doctors in the past with their supplies and their equipment, and I was always the relationship guy. But my excitement grew when I got introduced to surgery, and then I became more of a trusted clinical advisor because obviously there's a protocol, and you have to have the right tool at the right time to complete the job. And So through that, I literally like got, my balloon and my excitement level was off the charts. And then, but that, through that passion, that's kind of why I created On Target Dental Presents, and why I wanted to find the best is because I love my doctors so much. I don't want to see them just doing the same procedures over and over and not learning, not exploring, not checking things out. And a lot of times in their offices, that's all they can do. That's all they can manage, and it's a lot of times you have to pull yourself out and talk to this person over here, talk to that person over there. So that's kind of why I started this whole thing. And I think that for San Diego, we have a tremendous amount of resources, and I look at it as we're one big community. If you're involved in implants, that's what I want this series to be all about. And then, the next time that we see you guys, like next Thursday, I think what we'll do is we'll bring the audience in and we'll have a little bit of interaction, and we can hear some of those questions and those answers and that sort of thing. But I think we've got enough for today, and I'll let you guys go back to your lives back there in Montreal. What's going on back there?
Excellent, Chuck. Thank you so much for having us. I mean, this is just already stimulating conversation. We're looking forward to interacting with the doctors next week, and we're here to help make dentistry better, make ourselves better, and we're loving it. So thanks for having us. This is an honor.
Absolutely. We're going to broadcast this tonight at 7, and from 7 to 7:30. And so it'll be a Facebook event, and then going forward, it'll be 7 and 7:30. Whereas we'll probably go to maybe a live